everybody. I'm just chatting, we're laughing with my patient. We're happy. Have this lovely patient that I've seen quite a few, I think 4 or 5 times in the last 2 to 3 years. You guys went on holiday, didn't you? How was it?
It's fun. Yeah.
She said she had fun. So we have this lovely patient who had nail surgery before, and you can't see it, but the nail is actually a bit deformed. I probably will. Do I want to drill it back? Actually, I don't want to contaminate the area. I'm not going to drill it back, but I will show you when I tip the toe back the kind of deformity itself. I'm just putting this tunicate or tunicot, well, tunicate because tunicot is the brand name on, and this is to reduce the circulation in the toe. I'm just going to push that down. So we already injected a local anesthetic. So if we look here, you can see that the nail is very 3D looking, and there's a little tiny hole there. So we're just going to remove it completely, which is a very simple procedure. I'm going to loosen up the root of the nail like this. Voila, voila, voila. Voila, voila, voila. Easy peasy. Once it's, and usually you would feel it become loose. So right now it's a really tough cookie, and you hear some kind of clicking noise. I am going to grab it with my forceps. So very easy. Once you loosen the base, kind of like digging a tree. Don't dig trees, obviously. Trees are useful. And then you loosen it up. Voila. So you can see underneath it the thickness of it, like that. And that's just your kind of debris and dead skin on there. So what we're going to do is just have a look at the nail bed. So that now matches the toes. Just a little bit of dead tissue. I would need a 15 blade, please. Thank you. So, from the previous surgery, you can see there's a bit of scar tissue here. Just going to remove the dead skin. And then that's it. So easy. Easy peasy lemon squeezy. Was that quick? Look at that. How to start dressing. And then just this dressing that is massive for the toe. I know some of you guys don't like my dressing, but I like big dressings just to contain blood and also to restrict some of the movement, because you don't want somebody to go for a run. You kind of want them to rest, and sometimes having a dressing like this. I just use that because their foot's so small. Stephanie, can you just zoom it up for me? So
yeah,
that
same.
that's nice. And you can take that with my blood cell. And just take that to secure that. And you just press that toe for me, please. So that's one done. Beautiful, isn't it?